Hi there, Dr. Moses, general pediatrician. Today I want to talk about walking pneumonia. You may have heard of it. I've been seeing a lot of kids with it. And the CDC actually released a statement recently confirming an unusual spike in the cases of walking pneumonia nationwide. So I figured I'd talk about it. So what is it exactly? Overall, it's just a mild form of pneumonia. They call it walking pneumonia because you have it, right? Pneumonia is an infection in your lungs, but you're still able to function. You're still able to perform your day-to-day activities despite being ill with this infection. Walking pneumonia can be caused by many organisms, but I'm just going to focus on something called Mycoplasma pneumoniae. That's the one that bacteria that causes most of the infections that we see. We typically see it in school-age children between the ages of 5 and 15, but you can see it in ages outside of that age range as well. Walking pneumonia is contagious if you are around someone else that has it and they're coughing, sneezing into the air, and you inhale those respiratory droplets. You can end up getting sick from it. Now, the incubation period for mycoplasma can be up to 3 weeks, meaning if you get infected with the organism today, it can take anywhere from a few days to up to 3 weeks before you start showing symptoms. So it's a slowly developing disease, so to speak. Some of the symptoms of walking pneumonia are very similar to symptoms of your typical viruses, so it can be hard to diagnose. There are blood tests available and even nasal swabs available to help isolate the organism mycoplasma to see if you have it. But those tests are not readily available in a lot of outpatient offices, and they're not reliable all the time as well. So it takes a good history, a good physical exam from your healthcare provider, and a high index of suspicion to be able to diagnose walking pneumonia. So what are some of the symptoms? Typically kids have a fever, sometimes it's low grade. There's a cough. The cough can be dry, it can be productive, it's typically worse at night, and it can last for a long time. Kids can also have headaches, sore throat, ear pain, chills. They can have a rash on their body, weakness, chest pain with the cough. So if your kid has any of those symptoms that have been lingering for a while, please have them see their doctor as soon as possible, because they may have walking pneumonia. In cases where your doctor may be unsure, they may order an x-ray to confirm whether or not you do have it. Walking pneumonia can be severe. You have cases where kids maybe develop other complications, difficulty breathing, shortness of breath, even a more severe form of pneumonia on top of it. In those cases, kids would need to be in the hospital to be treated. Now, for the most part, walking pneumonia can get better on its own. But in other cases, you may need an antibiotic. Typically, it's azithromycin. In the adult world, it's called a Z-Pak. A 5-day course of that can certainly help you start feeling better, but the cough may still linger for a few days to weeks after that. So walking pneumonia, it's going around. If your kid has any of those symptoms, talk to your doctor today, and hopefully you don't have it. Until next time, stay safe, stay blessed, take care.